The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the Weymouth Community Access staff or its board of directors. WCA, in compliance with FCC regulations, is prohibited from exercising control over the content of independent member-produced public access programming.
I want to thank Jeff and Casey and Kathleen. Without them today, they transformed this whole place. When you see Welcome Phyllis's guests upstairs, right. That never happened before them. This intro never happened. It's wonderful.
That's awesome.
And yes, they're talented, gifted, wonderful people. Dr. Rick Wolfert, am I have your name right?
Yes, you do.
W-O-L-F-E-R-T. E-R-T.
That's right.
You're a dentist.
I'm a dentist in South Weymouth. I practice down by the air base on Route 18.
So is it down by where, past the mall, past Marshall's?
Yes, past Marshall's, more across the street from the 99 restaurant.
Okay,
right
that's very young.
Right down that direction.
And you're a dentist by yourself?
I'm a general dentist. I practice by myself. I chose not to be in a group practice or in a conglomerate like Aspen Dental or Gentle Dental. I felt like I wanted to have more control over the business aspects of the practice. I could run it the way I want to. I could charge the type of monies that I wanted to. And I could treat the patients right. Because I felt that in a bigger practices, sometimes you have to go along with who owns the practice. So I really didn't want to do that.
You have a dental hygienist with you.
I have a I have more than one. I have one almost full-time hygienist, Elizabeth, and then I have two part-time hygienists. So we have a lot of hours that we need to cover because I'm competing against these bigger practices, so I want to be able to offer more hours. So
and you have an office manager.
Office manager and two part-time receptionists. Right.
And you, just you, does
just
all
me
the
as
work.
the dentist, right.
Okay, how long you been a dentist for?
I graduated Tufts Dental School in 1981. So it's been quite a while. And when I got out of dental school, I decided that I needed more experience. So I went into the Navy. And I spent 7 years in the Navy. And then
as a dentist?
As a dentist, that's right. Spent some time on an aircraft, 2 years on an aircraft carrier. In fact, that's where I got my call line and my website, Tooth Boss, came from being in the Navy. Because the Navy has different departments on an aircraft carrier, one of which is the air boss, and the air boss is the guy that's in charge of all the airplanes. So they started calling us the Tooth Boss. So that's where that came from, and now I have a website called toothboss.com. So.
And people should know you're in the reserves?
I'm in the National Guard Reserves.
You were in Iraq?
In Iraq in 2004, and still in the reserves. It's my 32nd year, so I can say the same thing that Scott Brown says. I've been in the National Guard for 32 years.
Do you have a rank?
I'm a full bird colonel.
Isn't that wonderful?
Yeah, I think, I'm very patriotic. I come from a very patriotic family. Both my brothers served in Vietnam, so I felt the need to go in myself, and I'm really the only one that stayed in for this amount of time.
That is very, very commendable.
Thank you very much. I appreciate
that. So you are a full, do you do
colonel.
your own implants? We're going to talk about everything, but what do you offer to your patients?
I'm a general dentist, and general dentists do a wide variety of services, but the more extensive services we usually refer out to our specialists.
I love that.
Yeah, I think that I've been able to put together a team of very highly qualified individuals, even though they don't work in my practice, and that's the difference between myself and these Gentle Dental and these big, large group practices, is that I choose to work with whom I want to work with, and I can pick and choose who I want to work with, and that was very important to me. So I've put together a very qualified group of oral surgeons and periodontists and endodontists that reflect my own philosophy, and that was it's been extremely rewarding in order to do that. So.
Why do people, when you get the call, your phone rings, is it for, I have a cavity, I have a toothache? What is the usual procedure? Why do we go to dentists? For our general maintenance every 3 months, or when a problem happens?
Most of the time these days, it's you know, for general maintenance. They'll call me up and they say, I need a new dentist. I just got dental insurance, and I want to change dentists, or I want to start a program, or well, whatever. Usually it's that. But,
should people have dental insurance?
I'm sorry?
Should people have dental insurance?
Dental insurance is a double-edged sword. You know, I'm glad people have it, because it gets them to go to the dentist. But you know, dental insurance was created in 1974 when Mustangs cost $2,400, and the general benefit was $1,000. Well, it's 2012. Mustangs cost $40,000, and yet the general public is still only getting $1,000 to $1,500 a year.
Which is nothing.
Which is nothing, really. If you transpose those numbers, really, you should be getting a $5,000 to $10,000 benefit. But the insurance companies decided that they want to keep the money, so they do. So, you know, I'm glad that some people have insurance, because it does cover minimal stuff. And sometimes if somebody doesn't have a lot of work that needs to be done, you can spread their case over a couple years and get it done and maximize their benefit. That's what we try to do. But if somebody comes in with a lot of need, it really doesn't effectively manage that. So.
And what's a lot of need? They need cavities? They need
a lot of cavities. Maybe I had a fellow this past weekend. I felt bad for him, actually. He came from North Carolina. He lived up in the Appalachian Mountains, where there wasn't a lot of good care. Most of his teeth in his mouth were loose. He's in his mid-30s. So we don't see that a lot around here. But in poor areas of the United States, there's a lot of that. So he's probably going to lose most of his teeth in his mid-30s. That's awful. I mean, the digestion of your food starts with your teeth. And if you don't have good teeth, then your health is going to be severely affected. And there's studies now that show that heart disease and diabetes come from poor teeth, because you can't eat properly.
My doctor always says to me when I do my checkup, have you been to the dentist? That's the main thing.
Right. So we have, you know, obviously in the Northeast, particularly in the Boston area, health care is a priority. In other parts of the United States, it's not. And unfortunately for this fellow, dentistry was low on the list. So
what will happen to him? Will he have his implants? Who could afford a mouthful of implants?
Well,
will have his teeth pulled?
Ideally, I think I see him down the road as possibly having some implant retained dentures. He's such a young man. You hate to see him go with just dentures. Dentures have been a great service for many years.
But they wear out, don't they?
Well, not that they wear out, but the bone that they are supported by shrinks, and then they become less useful. You'll see a lot of the elderly without their lower teeth in, and that's because their lower jaw has shrunk so much, the lower denture can't be maintained. So nowadays, with the advent of implants, which, by the way, the first implant was placed in 1955, over 50 years ago, 57
but
years
it's
ago.
not that.
But it didn't come to the United States that quickly. I'd say in the last 20 years, implants have really taken hold. And what you can do with an implant, particularly with somebody that doesn't have any teeth, is you can have a surgeon place 4 to 6 maybe in an arch, and the denture actually snaps in. So it's a great service for patients.
When you say the denture, you mean false teeth snap in?
False teeth actually snap in.
Oh, I thought you put in a cap after.
That's another way of doing it. Let's say somebody has a full complement of teeth but have lost one tooth. Then you can place an implant in there, and you can put a cap right on the implant. So there's a lot of ways you can use implants, and they're just mainstream now. Unfortunately, again,
they're expensive, aren't they?
They're expensive, and insurance companies think it's too new or too modern, and they don't cover them a lot of the times, which I think is a sad affair. But many people, you know, even people that don't make a lot of money, they want good teeth, so they
the
come
first
up
thing
with
you
the money.
see.
Yeah, they come up with it, and they get it done. So
Let me ask you a couple of things about bonding, but first, how do you take care of your teeth to keep them clean? Do you like the electronic toothbrush, the electric?
well, what I do with patients is when I bring them into my practice, the first thing I do is examine them, because a lot of dentists bring their patients in through the hygienist, and then they never get to know them. You know, I mean, I want to get to know my patients. I want to do a complete exam. I want to discuss their treatment needs. Usually we treatment starts with getting the foundation in shape. The foundation is their gum tissue and their teeth, you know, and the bone that surrounds their teeth. So, you know, most people these days in this area require their teeth to be cleaned once every 6 months.
Is that enough?
For most people, all right? But there are some population that need it more than once every 6 months because they can't or don't have good home care technique in order to keep all the plaque and tartar off their teeth. So we need to see them more often. So that's the reason for that.
Isn't that biological? Is everybody makes different plaque?
Yes, that's accurate. There is some genetic component to how healthy your teeth are, but mostly it's how well you take care of them.
Okay.
Brushing and flossing.
And flossing is important.
Very important. Now let's get back to the automatic toothbrush. Now, the research shows that there is one brand that is better than most, and that's the Sonicare toothbrush.
Oh, good.
And when I speak to patients and when I see what their level of care is, if their level of care is good, I say keep doing what you're doing. Why purchase a $100 item, which is what Sonicare toothbrushes usually cost around, when you're doing okay with the toothbrush and floss? If I have some experience with them and I see that they're not doing a very good job, then I recommend a Sonicare, and we happen to sell them in my practice for cost. I don't make any profit on them. I just want to, you know, I feel strongly that they're going to do a good service for the patient.
What kind of dental floss could you use? I mean, there's waxed, unwaxed, and mint. I look at it in...
I know, it's crazy.
Does it
There's
matter?
all sorts of toothbrushes. What I tell people is whatever takes the plaque off, use.
What about toothpaste?
Anything with fluoride in it is very important. Fluoride's a very important drug that's been around for a long time. It actually sinks into the tooth and it makes it harder. So anything
Any
with
brand
fluoride,
name you like, or whatever has fluoride?
whatever has fluoride. I think fluoride's very important for dentistry and for kids. You know, when we get a kid in, we'll oftentimes suggest that they talk to their pedodontist. Their kid's doctor, and suggest that they have fluoride tablets, because if you can get it into their system, if you can get the fluoride into their system when the teeth are developing, then the teeth become very strong. They won't never get a cavity.
That's wonderful.
It is wonderful. And that's where dentistry has gone. We've saved a lot of teeth because of the new technology.
You see children, then you see all ages.
I see all ages. You know, if a child is a management problem, and some of them are, because we like to start. Yeah, they're afraid. We like to start them when they're young, 3 years old, 2 to 3 years old. We get them. We suggest that the parents bring them in, take a ride in the chair, watch them get their teeth clean. So if we get them used to the environment. But if they tend to be a management problem,
they're specialized dentists.
there's pedodontists that specialize, and they're very good.
Yes.
You know, the more management problem kid, they're going to maybe sedate them, or there's methods that they can do so that the kid doesn't have this fear of dentistry through the rest of their life. That's very important.
And my daughter was totally deaf, my youngest, and I took her to a special dentist who did special needs.
Right.
Had the time.
That's
and
important.
And I think that's important.
Very important. And I believe in pedodontists. I think there's a point in time where they should switch from the pedodontist to the general dentist, because, you know, it's tough for a teenage kid to go into a pedo office with all the little chairs and the balloons and all that stuff. That they want to grow up, and to come to a general dentist's office is
And you want to be, you were a regular dentist who people can say, this is my dentist. They can call you in the middle of the night if they have a toothache?
Oh, I have 24-hour service. So
do you really?
It's hooked right to my cell phone.